Hello, everybody. I am here again today. I just wanted to say hello, and I hope you all are well. Please let me know if you have any questions after this. Obviously, I'm recording it and then I'm posting it. It's definitely not live. So if you have questions after, please email us at info@ptbodytherapy.com. I will put all the stuff, the links in the bottom. So, hi, I'm Dr. Nicole Klersy-Mohr. I just am doing an intro video for all of you who may not know me. All of you that may know me already, I want to kind of go through a backstory on who I am, how I got to where I am. It's meant to give you kind of a background of where my passion came from, kind of my journey in and out of health and crappy health and back into health, and why I learned all the things that I've learned and what I've learned. So this is more of a, hopefully a 10-minute or less kind of thing, so I will just get started. Basically, my name is Dr. Nicole Klersy-Mohr. Obviously, I went through childhood just like anybody else. So when I was in my first 10 years of life, I went to the doctor with my mom, and I guess my mom said I told her I was going to be a doctor. Fast forward a couple years, maybe around 10 or 12, my dad used to have a bad back. He still deals with a lot of things, but he would be laid up from work, so he would come home from work and I would feel horrible. Dad's home, what's going on? Maybe I was a little bit younger, I guess maybe I don't understand, but he would lay there and then he'd be like, oh, I'm going to the chiropractor, I'll be fine. So then he would come back, and as soon as he would come back, it's almost like it was a miracle. He could walk again. So then I'm like, thinking to myself, I'm like, maybe I want to be a chiropractor. I don't even know what a chiropractor is. I didn't know that a chiropractor is a doctor, and that's a whole nother conversation I'm going to go through and talk about MDs and chiropractors and the similarities in schooling and the differences in another YouTube video. So watch for that one. That will be soon. Anyways, so my dad would come home and he could walk, and then he would go to work the next day, and it was a miracle. So fast forward, when I was in my teens and 20s, I had a lot of female issues. For all the women out there, or the married husbands or unmarried husbands who have siblings that are women, women's troubles can be a lot. And so I really didn't have anywhere to turn to. My doctor basically said, well, you can wait it out, or we can give you pain meds, or if you want, we can give you contraceptives, right? So sometimes that helps. So there's a lot of things where none of that helped for me, and I think a lot of women that also didn't help. And then after all that, I'm trying not to get into too much detail, but with women's struggles comes a lot of other things. So endometriosis, PCOS, fertility issues. Like many of my patients, many of you who might be watching, I was concerned that maybe I couldn't have kids. There was a lot of questions and health issues there that I wasn't getting answers to. So I did end up in my 20s getting diagnosed with cervical cancer. I was working with a chiropractor at the time that said, basically, if you change your diet and if you eat this way, that will combat cancer cells. And at the time, this was 20 years ago. That was, I don't know, I've never heard anything about this. This is weird. Are you a voodoo doctor? I wasn't a chiropractor at the time. And so I'm like, let me give it a try. So I changed my eating habits. I started exercising. They ended up taking part of my cervix out. And shortly after, I got pregnant. But there was a lot of things in there that I learned along the way about food and nutrition and lifestyle changes and different habits can change your menstruation and your women's issues, which for men, it can change blood sugar issues and hormone issues and help with testosterone, right? So there's a lot of things that food and nutrition I was exposed to that helps our bodies as a whole, right? So fast forward a little bit, I'm trying to just kind of give you a glimpse into what brought me into functional neurology, doctor of chiropractic, functional medicine. So basically, wanted to become an MD when I was younger. Got exposed to chiropractic from my dad, miraculously coming home from the chiropractor, and he was fixed and he could walk. Ooh, like what? Fast forward into my own issues, women's health, having a chiropractor tell me that food can change my menstruation and my overall health, and being confused about that, having to look into it. Then I realized that, well, I want to help people, but chiropractic school was a lot, so let's just do massage therapy. So I attended Aveda Institute in 2004, I believe it was. I graduated. It was a 4-month, 40-hour-a-week. You're in, you learn about these, you take your boards, blah, 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 you get out. And then I ended up opening my own business in Minnesota, got from 1 to 3 locations. Patients started coming in and saying, hey, what's this? We started allowing patients to say, I have these questions, and I'm like, well, I'm not a doctor, but that sounds like you should talk to your cardiologist or your neurologist or your DO. They'd go, and then they'd come back to their next appointment, and they're like, you're right. And I'm like, okay, well, that's cool. I'm glad you're getting help. And they're like, can you just be my doctor? And over years and years and years of doing this, and then treating carpal tunnel and avoiding carpal tunnel surgeries, and treating shoulder issues, and helping with avoiding rotator cuff surgeries, yada, yada, yada. I mean, you talk about different health concerns. Those are some of the biggest things that really drove me. All my patients or clients at the time who were massage clients, really, you drove and inspired me to go back to school. I had a knack for it. I like to figure out puzzles, and the body is just another puzzle, right? So doing massage, opening different clinics, having different either employees and or people renting rooms or whatever else it was, I really honed in on my craft of soft tissue manipulation, massage therapy. And now I'm in my second, almost third decade of doing massage, and I've seen no less than probably 1,000 people just get better of whatever, their low back pain, their hip pain, their knee pain, their runners, their lifters, their triathletes, their construction workers, pregnant women. There's a lot of different things that have come into my office over the years that I've really been able to make a difference in, because I love patients and I just want to see people get better. My motto here is, I love you, but I don't need to see you in my clinic every day, okay? I want you better, and I want you moving on. Anyways, so basically, jumping into the next chapter, I have this written down because I'm like, oh, I'm never going to remember any of this. Anyways, in 2010, I decided that I'm going to finish my undergraduate degree, and I'm going to apply for chiropractic school. So I did that. I entered chiropractic school in 2011 in Minnesota, Northwestern Health Sciences University, and I loved it. It was very rigorous. I was pregnant when I started the program. I had my first kid a couple months into the program. I literally left the hospital to take a couple exams 2 days after giving birth, and then coming back. I took it very seriously. And I really, really wanted to just get through the program, become a doctor of chiropractic and see what that could bring. I ran my massage business. I closed 2 locations and ran my massage business out of 1 location while I attended chiropractic school for those few years. And then midway through the program, I started getting migraines. First they were like once a week, you know, I was like, oh, I'm gonna get acupuncture, I'm gonna get massage, I'm gonna rest, I'm gonna drink lots of fluid, I'll exercise, I'll get adjusted, all these things, because we had free access or minimal pay as a student there. So I went and did all these treatments and nothing helped. Then my migraines became daily and I was throwing up and I was sick and I was dizzy and I couldn't do anything. I couldn't attend class, I couldn't drive, I couldn't eat, I couldn't sleep. It was horrible. One of my friends introduced me to a doctor who does chiropractic neurology. And basically chiropractic neurology is anything a neurologist does, right? Except for drugs and surgery. So if you have brain-based issues, if you have a stroke, concussion, they find out how your brain's working or not working with eye movement and other different tests that they can really pull out the issues of your brain and treat that. So I got treated for a week and then extended just, I think, a couple treatments into a month, I think it was. And literally, I'm like, what is this, voodoo? This is so intriguing. So they found the exact issue that was going on. I had multiple concussions and everything was just not tracking right in my brain. It was overstimulated, understimulated, I mean, everything you could think of. Anyways, so after that, I decided I need to look into this neurology program because this is a piece that I think a lot of us chiropractors are missing. It really got into the functional part of stroke victims and concussion victims, so a lot of athletes and a lot of the older population. It also deals with autism and ADHD and a lot of like Tourette's, a lot of different conditions as well that really, really, really can get to the root cause, treat the brain, get it talking to the body and to the other parts of the brain efficiently, and then working, right? So it was really neat. I took 300 hours with Carrick Institute. A lot of that I traveled to Chicago to do on the weekend seminars, and they were intense and it was a lot of fun learning all that stuff. I am board eligible. I would like to, in the next few years, I just printed out the exam and what entails on it, so I'm going to be going through a lot of that soon, so wish me luck on that. Anyways, fast forward, when I was a couple years into practice, so that was 2015 is when I graduated, and I took the Carrick Institute program pretty much like 2014 to 2016, I believe it was, and it was 300 hours, and it was a lot of information that I got to bring into practice. When I was about 2 years into practice, I actually threw my back out, which is embarrassing as a chiropractor. Anyways, I'm going to talk about it because it's just part of my story. When I threw my back out, it was because of poor ergonomics, and I was not exercising. So exercise and get your ergonomics correct, right? So sit in the right chairs, do the right things, move, don't just sit around. I will tell you that from experience, it was excruciating, and all of you that had a blown disc can understand the issues with that. So my empathy goes out to all of my patients who ever had facet or disc issues. Anyways, so once I went through all of that, I learned that I need to understand and work on ergonomics just as much as anybody else and learn to teach on it. So I did, And I got treated 3 times a week for X amount of weeks, and it was annoying and painful, but as I tell my patients, stick out the treatment protocol and you will get better, okay? I'm just gonna say from experience, that does help. After treating patients for a long time with chiropractic, with massage therapy, with chiropractic neurology, right? So you're dealing with all the components, muscle, neurology, bone. You're dealing with the musculoskeletal, all this stuff, but there was one piece that really was missing for me, and I started seeing it in patients. And everybody, right, so I would say 25 to 40% of my patients were really seeing a good change. If it was straight muscular, they would be better. If it was straight chiropractic and their bones were misaligned, or they had some ergonomic stuff, they were getting better. If they had strokes or they had any kind of paresthesia, right, that was brain-based, we would treat and they would get better. But a lot of people, the nutrition part, they had a deficiency, they didn't know how to eat, they were eating crappy, and I wasn't addressing it. I understood, like, you got macros and micros and you got nutrition, and you know, this is anti-inflammatory and here, take this, but I didn't have an in-depth study. So that's where I went and did functional medicine program online, 200 hours with the Functional Medicine University, and it was a really good rounding of my clinic, right? So I learned, you know, in functional medicine you learn about oxygen delivery and mechanical stuff, about if you can't get your lungs expanded because your ribs are subluxed, right? So you need oxygen and you need iron, right? So fuel delivery, and you learn all that. But when you're not practicing it, as far as a nutritional thing, it just didn't click for me. And so when I went and took all the classes for functional medicine, that's when I started going, ooh, oxalates, you know, amino acids, peptides, like what is all this stuff? Heavy metals. You start focusing and learning that it wasn't just neurology or musculoskeletal, but it was also giving the nutrition, the macros, right? So the calorie intake. Some people had way too much, some people didn't have enough, you didn't have the right ratio, but also the micronutrients, right? So maybe you didn't have enough vitamin A or vitamin D or whatever that is, or you had too much and it's pushing this system. It really rounded that out. And why I'm getting into all this stuff is because I really have a passion for getting people answers, to finding the root cause, to understanding where is your body at and why is your body needing X, Y, Z, okay? That is important because many people come to my office and they don't know why they're at where they're at. Nobody's been able to sit down with them. They haven't articulated the right questions. There's a lot of the miscommunication on the patient end and the doctor end, whether it's time constraint or knowledge or whatever that is. And so for me, I have a private practice and I get to go, hey, I want to spend extra time with you, and this is why. If I can educate you with X, Y, Z, and that's why I'm making these videos, is you can get an understanding why I do what I do, what background I have, what knowledge I have, why I'm putting it all together. A lot of people ask me this, and now I'll be able to send you to my YouTube and say, here's a background of what I do. This is why I do what I do. This is who I want to see get better. This is who I usually see in my practice. Here's the ergonomic piece of it, you know, why sitting is X, Y, Z. There's a passion that I have to educate, and most doctors have it. A lot of them are not in a private practice, and a lot of them aren't able to get this information. So just to kind of back up, I got into being a doctor because my patients needed advocacy. And I love puzzles. And so for me, deductive reasoning is something that comes quite simply. It doesn't come that way for everybody. So I have rounded out my education with massage therapy. I've been a massage therapist for 20 years. Chiropractic, so I'm a doctor of chiropractic since 2015. Chiropractic neurology, I finished in 2016. And then functional medicine, which is just basically the use of either endogenous or exogenous things made in our body or things we ingest to push different pathways, food as medicine type situation. And that I graduated in 2019, and I've been implementing into my practice, into our patient model here since 2015. Well, Perfect Touch Massage has been around since 2007, I believe. So that's where I want you to understand is my passion is to find what's causing the problem, fix it, and so that you can live a healthy lifestyle and not have to pay a crap ton of money to get health. Now, like I tell everybody, you can pay me and come in however many times you want. I'm totally okay with that. And I might say this to you in person because I say this to a lot of people. However, for those of you like me, give me the education, tell me what's going on, and I will come in as needed. So, get healthy, get out of my office so I can see other patients, or if you have another thing come up, then I can see you for that. It's an interesting thing in my office is I love to see you, but I only want to see you if you need to be seen. Okay? That is what drives me. I want to give you answers. I want to educate you. I want to make sure you have what you need and you get better. That's important. And I'm so excited to be able to do this again. Yeah. So basically, if you have questions, I will put my website at the bottom. It's ptbodytherapy.com. It will have a way to schedule with me, call me, email me, anything you need. Questions, write them down, bring them in. I would love to see all of you in person and help any of you that has any issues. And this went over way further than 10 minutes. So hope you're all well, and we'll talk again soon. Bye.